Well, welcome to the Business Spotlight series. My name is Heather Frierson, and I'm your host of the Business Spotlight podcast. And today I have James Bates, the founder and CEO of AdviNow. And we're going to be talking about his business journey to business ownership, the challenges, the best practices, and really just share a sneak peek of what it's like to own and operate a business. So, if this is your first time to the show, be sure to like and subscribe so you can get a notification every time a new show drops, just like this one. Well, James, welcome to the show. I'm so glad you're here.
Thank you, Heather. I appreciate you inviting me.
Well, if you could just share with our audience a little bit of a background about who you are and your business.
Sure. Short introduction about me. I've been in the high technology field for 30 years. Most recently, before AdviNow, I had the opportunity to run the operations here in Arizona of Freescale Semiconductor. The business that I ran was self-driving vehicle technologies. So we made the technologies that Tesla, Google, Daimler, GM, everybody uses to do the auto brake and auto steer in the cars today.
Wow.
Previous to that, I had the opportunity to live in the Bay Area and Palo Alto and work for some fantastic companies that worked on things for the Apple Watch, the iPhone, Samsung, lots of different IoT devices, Nest, Fitbit. You can think of everything that has been evaluated and used by the public over the past 20 years. And I've had a great opportunity to be involved with the technology there. Today with AdviNow, this is my first foray into healthcare. And it's a little bit of a story about how I got into healthcare. When Freescale sold, I ran the operations and I was an officer. I had to retire. It was a great time to retire, actually. So it wasn't a had to thing, I guess, but it was a good time to retire. Very, very beneficial financially for me. But I had a 2-year non-compete. And that meant I had to do something that I've never done ever in my life for the next 2 years, or I could play golf. And, at 45 years old, golf is fun. It's just, I can't do it every day. So I started looking at healthcare really because healthcare was one of the biggest issues of our time. This was 2016, and the ACA, or the Affordable Care Act, had just passed, and people were at each other's throats. Half the country hated it, half the country loved it. I was ignorant. I had no idea why it was good or bad. So I thought, you know what? I'll just buy some medical practices and I'll do a roll-up. And so I thought, okay. So I started looking at urgent care companies, primary companies. I looked at cardiology groups, surgery centers, just a lot of medical practices that were for sale. And I started doing my diligence. And, you look at the profit and loss, you look at the balance sheet of the business, and you determine what its value is. Well, to my shock, the businesses were pretty bad businesses. In fact, medical practices average 3% profitability. Hospital systems average 1% profitability.
Really?
And wait a minute, you'd say, James, isn't healthcare 20% of our whole economy, our whole
Yeah,
GDP?
exactly.
Hospitals, practices don't make money. Doctors make good salaries, but nothing's left in the actual entity itself.
That's so interesting.
It was shocking to me. And so I'm like, I don't want to buy medical practices. If all I make is 3%, I can buy a government bond and save myself the headache and get the same return. Right.
Yeah.
And so, so there, I can't do this. And
Yeah.
so I thought, okay, well, I'm gonna decide something else to do. And I was doing due diligence on roughly 30 different medical practices. And I went to all the owners and I'm like, thanks for your time, but I'm walking away. And this is why. I just said, your business kind of sucks. Sorry. And,
They're like, yes, we know.
and one of the guys that I'd been doing diligence with, he says, look, James, I understand the business is challenged. He said, rather than, I understand you don't want to buy it and I understand the reasons. I wouldn't want to buy it. He goes, but help me fix it.
Oh.
And I thought, okay, well, this is a different approach, and it's better than me playing golf every day. So why not? And so I jumped in, and when I was looking at it, I said, health insurance companies aren't going to pay this small little urgent care practice any more money because I asked them to. So renegotiating contracts isn't going to help this guy. So the value of the widget is a medical encounter, right? The doctor's visit. That's what you're selling. The value of that is set by the insurance company, and you're not going to change that. So the only way to fix the business is by looking at the cost. So I said, okay, well, let me do a time and motion study. So for those of you who aren't familiar with what a time and motion study is, it's where you actually measure every movement in a manufacturing line. So you look at every time a person is picking up a screw, putting the screw in, every time they make any movement, and then you cost it all the way down through their benefits to exactly how much does it cost to pick up that screw. And if you had a robot that took that screw and put it in for them, how much would that save, right? And what would be the value? So that's called a time and motion study, where you basically take every single motion, you assign the time associated and cost associated with it. Well, I did that, and there were a couple of findings that were basically so powerful, I had no choice but to found the company, quite frankly. The first one was that the doctor was 70% of the cost of the medical visit. And you'd say, well, that's kind of intuitive. That makes sense. And so if the doctor is 70% of the cost, that means office, insurance, everything else outside of the doctor is 30% of the cost of that medical visit. And you'd say, okay, if you're trying to fix a business that's only 3% profit, and you can only go after 30% of that business costs, chances are you're going to get diminishing returns really quick. You're not going to be able to fix the business. So you've got to go after that 70% of the cost, which is the doctor. Well, most doctors I know are not happy about making less money. In fact, I have yet to meet one, so with that in mind, asking a doctor to make less money is not an option. So another piece of the time and motion study that was very interesting was that 66% of the time the doctor was spending on that patient visit had nothing to do with their medical licensure. So,
wow.
So what does that mean? That mean like if I ran a factory and I had an engineer who I was paying like $500,000 a year for, 2/3 of his day, I'm putting him on the assembly line that anybody could do. And
Wow.
that was like the most crazy thing I saw. And so I'm like, wait a minute. So what you're telling me is that 2/3 of your time anybody can do. And they're like, well, not anybody. You have to have medical knowledge, but it doesn't require licensure. You could hire somebody with 0 licensure, but if they have knowledge, they could do it. Like, wow.
Wow, that's eye-opening.
So looking at the list of the things that were on there, AI could automate all of them. So using the knowledge that I had from my previous life in artificial intelligence, I decided to develop an artificial intelligence in medicine that would completely automate all of the things that a doctor does during a visit that don't require his license or her license. And so that is what AdviNow Medical does. We completely automate all operational and clinical activities of a medical practice.
That's amazing. First of all, AI, with it being 2024, it sounds like you've been doing this for a while. Before we started
I'm an
hearing,
old AI guy. Yeah.
before we heard about it. Am I right?
Yes.
That right
I've
there
been doing
is
artificial
shocking and
intelligence before ChatGPT came about. That's for sure.
That's what we know about, right? Is ChatGPT. But so that's incredible that you were on the forefront of AI, but then to learn that really, if you think about it, and probably you have, a lot of jobs that people take, there's so many parts of their job, especially when you talk about business owners, that they're doing that it's outside of really their skill set or power zone, maybe is a better word to say.
Yeah.
So to identify that in the medical field is incredible.
I mean, we
So,
have a shortage of doctors today. Think about that.
Yeah.
1 out of 3 people in the United States have a primary care physician.
Yeah, that's shocking too. I just had a friend tell me that she had to find one. I was like, what? You don't have one? So you mentioned earlier that, of course, doctors don't want to cut their paycheck, and I get that. They go to school for a long time and they have a big bill themselves, I'm sure. But besides
Totally.
that, when you introduced this as an idea, walk me through that process.
So the interesting thing is pre-pandemic and post-pandemic,
Mm.
have a different promotion, right? Pre-pandemic, if I walked into a medical practice and said, I use artificial intelligence to automate your operations, they would like, back.
Yeah.
It's a massive fear factor of
Mhm.
yeah, we don't trust AI, we don't trust
Sure.
automation, you're not going to replace me, they're worried about the Terminator coming in.
Yeah.
And post-pandemic, everything changed.
Mhm.
So I walk in, doctors are so burned out, there's
Oh.
so much regulatory oversight on practices from payers, from the government, that's
Mm.
forcing all this documentation to be done, right? I mean, so
Mhm.
that's essentially 2/3 of their job. 30 years ago, 5% of their time went into medical records. Today, 66% of their time goes into medical records.
Wow.
So if you ask a doctor who started practice 30 years ago, they hate electronic medical records because they blame them for their inefficiency. And they're like, I can't make money anymore because I spend all my time being a clerk.
Mm.
Well, when I go into a doctor and I say, AdviNow lets you be a doctor again.
Mm.
Think about spending all your time with patients instead of just 1/3 of your time with patients.
Yeah.
They
Wow.
love it. And they basically cannot get enough of it. So selling AdviNow is very easy to sell as
Mhm.
long as you can have a doctor who's willing to try. Now, there are certain physicians who don't want to change anything, right? They've been doing it the same way and
Mhm.
they're set in their ways.
Yeah.
Um, Probably those guys will be forced to change after a
Mm.
few more years because the AI is going to enable profitability, efficiency at a
Mhm.
level that they will not be able to compete at. And it's not
Yeah.
about, hey, let's change the concierge medicine, right? I mean, they get a lot of doctors trying to do that. But the concierge medicine guys are all using us. So
Mm.
now you can have a concierge doctor who sees 500 patients. Each patient loves it because they get immediate responses 24 hours a day, 7 days a week. And then you have the other concierge doctor who can only have 100 patients and they're taking calls nights and weekends,
Mm.
from the beach in Hawaii instead of having a relaxation day. And
Yeah.
so what life do you want really? Right?
Right. Well, it sounds like just after the pandemic, is it fair to say that this is when AdviNow took off?
Yes. Yeah. I mean, I would say that that's where we're seeing the significant interest. Pre-pandemic, we got a lot of interest from people who weren't traditional hospital systems, as an example.
Mhm.
So guys like Safeway, grocery stores, they have next to their pharmacy, they had a room and they wanted to put a doctor in every single room. Well, with AdviNow, they could be super efficient and that's possible. And so pre-pandemic, we had 27 locations opened
Mm.
before March of 2020. Now, our product was just released in December of 2019. So just in 3 months, we were ramping up, this work and we were planning to go to 1,000. Guys like CVS were very interested in putting us in all their minute clinics. Well,
Mhm.
the pandemic hit. The first thing Safeway did was say, we don't want sick people in our stores.
Mm. Yeah.
Sorry, every clinic shuttered.
Yeah.
And so when we started during the pandemic, we went after hospital systems, and guys like, Dignity Health or Mayo
Mhm.
Clinic or HCA, these very large hospital systems. They all had a lot of interest because they had staffing shortages at severe
Mm.
levels,
Yeah.
but they don't move very quickly, right? Hospital systems are slow. And so after the pandemic was over, that's when we saw really the smaller clinics really start to pick up because those
Mhm.
are the guys who during the pandemic got overburdened with all of the regulatory aspects. They suffered their own staffing shortages. Doctors started to do a lot more than they were doing before, and the burnout level was at all-time highs. And so they're
Yeah.
looking at anything to get their lives back.
Yeah, I bet. This is incredible, and I can see how it just has made things more efficient. And so, but as a patient, what does this look like as a patient going in?
Well, the patients don't even know it most of the time. So if you think about what's happened post-pandemic as a patient, you get a link on your phone that says, register for your visit coming up. And by the way, here's these 10 questionnaires that you got to fill out before you arrive at the clinic.
Yeah.
Most people get those. Those are called a digital front door. So
Uh-huh.
patients are used to it. The problem with the digital front doors that have come out since the pandemic is that they're dumb, right? They ask the same 20 questions every time. And you're like, you already know my grandma doesn't have diabetes. And you're sitting here answering all these questions that don't make any sense. You used to fill that on paper. Now you're filling them out digitally. There's no difference for the patients. But when AdviNow is used, they're now asked questions that are only relevant for their visit.
Wow.
So all of these ridiculous questionnaires that you're used to, they all go away. And it's 100% dynamic based off of what your chief complaint is, what your current medical condition is, and what your history is with that physician in that medical record. So the AI reads the record, the AI customizes every single question and answer session. And they ask every question a doctor would ask, but only the questions a doctor would ask. And right now, the ridiculous questionnaires that get filled out, they're filled out for insurance reasons and liability reasons, and doctors don't even look at them, quite frankly. And so the patients are spending all this time, thinking about, oh, my grandma's cousin had diabetes. Should I put that in there? And they're trying to figure out exactly how to answer these questions. And the doctors don't even look at it. They don't care. Unless the patient has diabetes, that's a different story, right? But then it's relevant. But most of the time, it's not really relevant. But if you don't collect patient history, then you can't bill at a certain level because these are the rules the government has put into place. So if the AI is collecting exactly what the government needs for you to bill at the most appropriate level, but everything the doctor needs, then the doctor just gets a summary of what's going on with the patient. So the patient doesn't even know that anything's different than it was before.
Wow.
They just know that when they see the doctor is asking them exactly relevant things from the questionnaire that they just finished taking. And then when they're done, the documentation and report that the doctor sends the patient is like perfect. Oh, we talked about these things. This was your condition. This is you've been diagnosed. This is why. And this is your prescription. The AI spits that all out for the doctor. And the doctor's just like, click, 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 click. I agree. Boom, done.
That's incredible. And I'm sure a big relief to a lot of the clinics and hospitals that use it. Yeah. So I want to walk back a little bit when you founded this, because what it is now is so big and clinics and hospitals are using it, I assume, not only all over the country, but the world, and it's getting to this level. So tell me about the process of how you went about pitching this to get the funding and assemble a team to create such a practice.
Yeah, it's been a journey, that's for sure.
I bet.
Coming from outside the industry, my initial thought was I would just contact people in the semiconductor industry. It was my previous life. And they would introduce me to their right partners in a venture firm. And so I called up people in Silicon Valley, in Sand Hill Road. And I knew all the guys related to semiconductors because that was my industry. And I just called them up and I'm like, hey, I'm going to do this healthcare AI startup and I want to come pitch it to you for funding. Set me up with your healthcare partner. And they were all kind enough to do that, right? And so I went to Sand Hill Road and made a stop at every single building along that ride. And so for those of you that don't know, that's where a lot of venture capitalists keep their homes, right? Their offices. But
not many of us can just walk down that road and knock on doors and it open. So it sounds like that's like trick-or-treating, and that's a feat, an accomplishment in itself.
Well, getting the intros is definitely huge. Without that, you have a rough time. And so you've got to find a way for somebody to give you a warm intro, really. And so that was very helpful because I did hold high level positions and had some successful business transactions within that industry. I knew the guys already. And so I got introduced, but the amazing thing is I had credibility with the semiconductor guys, but the healthcare guys were like, James, who? Advi, what? And they're like, okay, James, I get the premise. Selling someone on the problem statement that physicians waste 66% of the time, not a problem. Every VC gets it, right? It's a common issue. But then when they saw my solution and they're like, okay, I get what you're proposing. But why are you going to do it, James?
Mm.
You're not a doctor. Why are you going to do it? And so I got some VCs that were like, okay, well, move from Scottsdale, because I'm living in Scottsdale now. Move from Arizona and move back to Palo Alto. We'll put someone in your company from the healthcare field, and then we'll fund you. And I go to my wife, and my wife's like, I don't want to move back to the Bay Area. Stuck. I'm here. I love Arizona. I'm not leaving. I'm like, okay. So she says,
I
unless
love
we're
that you said
financially
okay.
required,
Yeah.
then I'll go with you, because she's a great wife.
Yeah,
But if we're not financially, if
sure.
we're not going to go bankrupt if we don't go, then I don't want to go. And
Yeah.
so I didn't take any of that money from the venture capitalists in Palo Alto. And so I went back and I'm like, okay. And I funded the first $2 million myself.
Wow.
And then I raised another $20 million from other people. And roughly half of that is from Arizona doctors and strategic customers that have
Mhm.
invested into our product. And I was lucky enough where I could fund it. I've put almost 10 million of my own money into the company at this point, where I could do that. Most entrepreneurs can't. And
Mhm.
so I'm in a little bit of a lucky position there for sure.
Mhm. For sure. And that's incredible, because what that allowed you to do is to really own it from the beginning and make the decisions you wanted to make,
Yep.
like not move for starters, but then also bigger decisions even for how you wanted to run the company.
Yes. And I think of it very interesting. If I would have taken the deals, probably AdviNow would already be a $1 billion company if I would have taken the money
Mhm.
from Silicon Valley venture capitalists. Why? Because they would have forced me to invest more, get the product done, more mature, faster. And I
Mhm.
would have got it done before the pandemic. And if we would have been up and running at scale before the pandemic hit, then we would have been the default for the pandemic.
Wow.
So I regret actually not doing it, because
Mm.
AdviNow would have been super successful and it would have happened before the pandemic. But at the same time, it would be a different company.
Mhm.
I wouldn't have owned it. They would have, I still own the majority of the company. That wouldn't have been the case.
Mm.
Now, they probably would have replaced me as CEO to some healthcare guy, right?
Mhm.
Guys at HCA or Mayo Clinic want to talk to more than an AI guy, right? And maybe they would have been right in those judgments, quite frankly. And if I was on the board, maybe I would be pushing for the same thing. Um, but it would be a very different company. And
Yeah.
so what's interesting is now, after living through all this, I am the expert. And the guys, the CEOs at the large hospital systems, they want to talk with me. They consider me an
Mhm.
expert, and I'm part of the club. And I've been able to become part of the club because, I wasn't replaced. And I'm sure after scaling up, they probably would have replaced me. And it
Mhm.
probably would have been the right decision, and the company would have been bigger, faster, right? I mean, you got all these things in your mind that you
Yeah.
think. Um, but I'm happy where we're at.
Yeah.
And I'm really excited about us growing and scaling and maybe even having that nice unicorn $1 billion exit here in just a couple of years.
Yeah. I love that. I hear that a lot with CEOs in your position, that there's always that conflict in the beginning of what to do. And I ask the question a lot, is it venture capital? Is it self-fund? What is it? Angel investors? And there's never a clear answer. It's always individualized.
It is, there's it's really interesting. If you're looking at it as an investor,
Mhm.
what do you want? Time is your enemy. You know the market today. You know what can be done today. So you should fund and invest and do everything to drive success faster, right? If you're an investor, that's what you want, because you can't predict 3 or 5 years from now the economy is going to be what it is. You can't
Right.
predict some new technology is not going to come out in 5 years from now. You can predict probably within 2 years to a pretty good degree. So that means you shouldn't invest in anything that's going to take 5 to 10 years to do. Um, so the venture capitalists, they look at it that way because they're smart people in general, right?
Yeah.
And so, but at the same time, if you're going to invest that level of money, you're going to own a lot of the company.
Mhm.
And so for a founder, if they want to run this company, going to venture capital and staying an owner is a very hard thing to do.
Mhm.
In fact, what do they say? 90% of all founding CEOs are replaced as soon as the company is in recurring revenue.
That's crazy.
90%. So the guys we know about, Mark Zuckerberg, Steve
Mhm.
Jobs, well, Steve Jobs was fired too, and then he came back,
Yep,
right?
yep. Mhm.
I mean, these huge founders, that's maintained CEO, Amazon,
Mhm.
they're the exception, and that's why we know about them. They're
That's
not the rule.
interesting, isn't that?
Yeah.
Wow. So I want to kind of go back to what one of the VCs asked you because it resonated with me, and it kind of will speak to your passion and vision a little bit. Why James with the medical system?
I will allow that VC to remain nameless, so I won't say who
For
it was.
sure.
But the interesting thing was, at the time, my answer was a
Mhm.
lame answer, right? It was, well, it's my idea, right? I
Which is
I know
typical, right?
AI.
Yeah.
I can do this, right?
Yeah.
But that the healthcare VC was looking at it as, um, you know nothing about healthcare, because I really didn't. I did a time and motion study, right? I mean, any first year MBA student learns that stuff. And so, so, so what I knew was this much in healthcare. Although AI, I was deep in AI, so I know AI, but healthcare, I didn't really understand anything except the fact that medical practices didn't make money, and so my response was, well, I'm the founder. I know AI well, and I think I can learn healthcare. But what I've learned through the process was that, I really did not know a lot of things.
Mhm.
And if I would have had that knowledge to begin with, the company probably could have moved faster. The company
Mhm.
probably could have been more successful sooner. And so, why was it me in 2016 when I was making those pitches, end of 2016?
Mhm.
It probably, I shouldn't have done it alone, which is what I ended up doing, right? I should have brought in a co-founder who's a medical person, and that VC was right. But because I did it the way I did it, I became the expert.
Yeah.
And now I can talk about really any business setup in the healthcare infrastructure, and I can be that expert, and I can talk to
Mhm.
anyone and sell them on the product because I know. And
Yeah.
if I wouldn't have gone through that, then I couldn't have known it. So it's, why is it me today? Well, that's an easy sale,
Yeah.
because, and nobody asks me that today. Why was it me in 2016? That was a very relevant question.
Mhm. But you have a passion and something spurs you on.
Totally.
So that's what I'm trying to get to is like, what is your why, James? What's your why? And why are you so passionate? Because I can tell it seeps through you.
Yeah. So when my previous life, in the automotive electronics businesses, I loved doing that. I was changing the world, right? Everyone who's ever driven a Tesla on full drive, they get it. They're like, wow,
Mhm.
this is the future. I understand. Um, and I have an opportunity to change it. And I've made a lot of money throughout my career. I've had 3 exits that have been really phenomenal. And I didn't want to work for money, right? It's not about working for money. I wanted to do something that would fix one of the most fundamental issues of our time. Working on self-driving vehicles, no one's going to say that is life-changing yet, right?
For the
But
environment, but yes, I get
yeah, but if we could actually eliminate the shortage of doctors in the world,
it.
if we could cut the cost of healthcare by 50%, another very interesting metric, and this is really just financial. If every doctor's office and hospital system in the United States adopted AdviNow, You could give free healthcare, zero copays, free healthcare to every single resident of the United States for less money than the government spends on Medicare and Medicaid.
Wow.
That's how
That's
much
a,
waste is in our system.
no wonder you're so passionate about this, because you've seen it firsthand what all of us here in America are doing that is hurting us.
A lot of people talk about payer systems, right? They say, hey, you want your single payer system or a commercial system. America's better because we have competition. America's better because of this. And the issue isn't whether it's a commercial payer or whether it's a single government payer. That almost doesn't even matter. The issue is the overhead that those systems have put on the world.
Mm.
And then the overhead for actually treating patients as individuals. Medicine historically has not treated patients as individuals, right? You have your primary care doctor, and your primary care doctor knows stuff and they know you and they treat you as an individual. But you go to a specialist, that's transactional. You go, you do all this, you get a surgery, that's transactional. You don't like have a relationship with your surgeon. And so what healthcare has become is transactionally based.
Mm-hmm.
Well, that leads to worse outcomes for patients. And in a transactional system like we've created, the only way that you can give longitudinal, so a lifelong following of the patient's healthcare, is to have very meticulous medical records. And so all of these regulations that Centers of Medicare Services and all these insurance companies are layering on to doctors is for them to create that longitudinal record to allow patients to have better outcomes. But what that does is it layers on the burden to doctors, and the threat the doctors get is, if you don't collect all this information, we're not going to pay you.
Mm.
So doctors are collecting it, and they're working literally. I know physicians that do 15 hours a day, every day. They do 12 hours of clinical and 3 hours of medical records such that they will get paid. And nobody likes it. When you AdviNow, what does AdviNow do? AdviNow takes away all of they don't need to become experts in what Medicare says. They don't need to become experts in what United Healthcare says. They don't need to become experts in anything. They get to just be doctors once again. And I look at that world, right? And my son's in medical school right now, my oldest son, and I'm really excited for him to be a doctor. But when he's actually a doctor at the end of the day, he won't practice medicine at all like people practice medicine today.
That's
And
interesting.
that's
So what's y'all's conversations like?
Between me and my son?
Yes.
So he's worked at my company, as he was applying to medical school. And since he's in medical school, he doesn't do it, but he still does research with a lot of people that he got relationships with through my company. And it's very interesting. He goes to University of Arizona in Phoenix. That's a medical school he goes to. And what he's learning is still just massive memorizations. They're not training him yet to do all the medical record stuff. So I think when he will really appreciate what AdviNow does is when he starts his clinical rounds, which happens next year, right? So in his second year, his third year is when all he does is goes around and is a slave doctor, right? And that's when he will really realize the difference that AdviNow will make. So in his mind, he's a smart kid, so intellectually he gets it, right? But he doesn't feel it yet. And so I'm looking forward to him actually feeling it and saying, wow, I mean, I can just sit and review the data, use what I use in medical school, and treat patients and have relationships with them. And I don't need to do all the rest of this crap.
Yeah.
Yeah.
And I would even think, this is just thinking of the future, what kind of things you can do together when you have someone on the inside doing the work and then you on the inside of AdviNow, and what kind of relationship and progress would even to take both sides, right? That would be really interesting.
I'm interested to see. My speculation, and this is where, of course, you never know the future, but by the time my son is an independent doctor, that's for the specialty he wants to get into, that's still probably 10 years away.
Mm.
Um,
Wow.
um, AdviNow will already be prolific. No doctors will be collecting and documenting data the way they do today. The AI will do all of that, and that'll just be standard workfare.
That's so cool.
So then what happens next, right? Some version of a true AI doctor where the AI is now treating patients and the doctor's just reviewing the work of the AI. That's probably the world that my son will get into.
Oh my
And
goodness.
so that means that, if you have strep throat or you have some type of UTI, a very simple condition, the doctor doesn't even really need to see you. You just need to go get a lab. Lab's positive, you automatically get your diagnosis and treatment. What AdviNow will do in the future is the patient just engaged with the AI. They get a lab, the results, they automatically get a script, and then they get the option to talk to the doctor if they want to. They never need to see the doctor, right? So that's where this all goes. And so my speculation is my son will start his medical career when that is our medical norm.
Incredible. That's incredible. My next question was going to be, where do you see this in 3 to 5 years? But you just answered that. That is the coolest thing ever. And I can see how that can help in so many ways. And I'm, for one, I'm not one of those that is afraid of AI. I think it's great, and it's not going to replace everything. It's a partnership is what it is. Yeah. So go ahead.
Yeah, there's such a shortage right now. It's crazy, the shortage of qualified physicians. I use Mayo Clinic for my primary care, and I love my primary care doctor. Totally awesome, right?
Yeah.
But if I want to see him, I'm booking 3 months out.
Exactly.
And what is that?
Yeah.
So if I actually get sick, I have to see some PA who's not him. And
because he's
that's
behind a
not the way
desk.
medicine should be.
Right.
He's doing all that clerical work.
Yeah. So if that's where AdviNow is in 3 to 5 years, where are you in 3 to 5 years?
I don't know. I guess I'm still running the company. That would be my, that would be what I'd prefer. If we end up selling and I'm not running the company anymore, then I've got a couple of ideas for the next generation healthcare devices that I would be founding my next rent company. So that's kind of my thoughts there.
So your idea is, which I love, is you don't really retire from something you love. You just keep going with the new ideas. There's no playing on the golf course unless it's a fun game on the weekend.
Exactly. I do like golf.
Yeah, I get it.
Not more than once a month. It's a lot of time commitment.
Visionaries like you just keep going. There's always a next, which is so encouraging and just, speaks so much about you and really how we can be as people and entrepreneurs and leaders. We can keep going. If we love what we do, we can keep going.
You love what you can do, you can keep doing. And there's a few sayings that are always very telling. You only go forward or backward. You never stay still. So human nature is, I'm going to reach this and then I'll be happy. Then I'm going to do this and then I'll be happy. I'm going to have my 3 kids and a dog and then I'll be happy. Or wait a minute, I'm going to get my $1 million house and then I'll be happy. Or I'm going to get my Bugatti and then I'm going to be happy. And you keep, nature is that.
You keep moving the bar and you never reach it.
Moving the bar, there's always that next thing to go after. And for me, I think if I was to retire and sit on my porch and yell at the mailman or something, I don't know what I'd shoot myself.
Yeah.
It wouldn't last very long.
I get it. Well, I love this conversation. I could ask so many more questions, but before we get to the rapid fire questions, is there anything that you want our listeners to know about AdviNow that we haven't talked about?
No, I mean, we're really excited to be part of the revolution with artificial intelligence and a industry that we all know. Either we hate it or we tolerate it.
Yeah.
Nobody loves it. And so let's make healthcare something that you love.
Yeah, I love that. All right, let's get into some rapid fire questions. Are you ready?
I'm ready.
All right. What would you say is the key to success for you?
Endurance. At the end of the day, I'm relatively smart. I'm probably not the smartest guy out there, but I'm relatively smart. And I can put disparate amounts of data together and put a plan. But a lot of people can do that.
Mm-hmm.
What people don't want to do is the 12 hours a day, 7 days a week for years on end. There's another wonderful saying, everybody's jealous of what you have, but nobody's jealous of how you got there. And so when I did my first startup company, I founded the international operations for a company named Silicon Laboratories. And I had no idea what I was doing. I was 29 years old, and somehow I convinced them that I knew what I was doing. And so they hired me. And the company went from zero to $500 million of revenue in 3 years. And that was my first big exit event. We did well as a family. But I always worked. And my wife sacrificed me not being there. I was on the road 6 days out of every week, pretty much. And she was pregnant with my second child. And it was hard on our family. Now, the company was very successful, and, she could have divorced me and retired, and luckily she didn't, but ultimately nobody wants that life, right? They don't dream and say, you know what, I want to work 18-hour days. They don't think that. But then they look and they say, oh, he's driving that nice car, he's living in that nice house, he's got a wife and 3 kids and a 2 yuppie dogs. I want that. But nobody wants what it takes to actually achieve it.
True.
And so that endurance is really what has been the differentiator, I think, for me. It's not intelligence. It's not anything else. It's just, are you willing to be committed and be diligent every day?
Yeah. So good. What is your one piece of advice that you would give to maybe other business owners or even executive leaders?
Yeah, there's a term that was very popular when I was just learning how to be a manager. It's called emotional intelligence. And the interesting thing about somebody who has been successful in their career is, in general, they've been successful early on because they were individual contributors and they were smart and they worked hard and they were diligent and disciplined as an individual contributor. Well, once it's not you doing the work and it's about you motivating other people to do the work, emotional intelligence, being able to really understand how your reactions, how you react to things and how that impacts other people. That is something that is very obvious for senior leaders in large organizations. And I've been part of very large organizations. And for smaller companies, it's, can you retain your staff or not? It comes down to a huge part of your success, being self-aware on how your reaction to things impacts other people.
I think we could do a whole podcast on that. I love that subject and really just how important that is and why you are where you are. Yeah.
Well, I've been lucky. So I'm a blessed life.
You're lucky, but also I would assume, of course, from what you just said, you have a lot of emotional intelligence and self-awareness that has helped you along the way to build the team.
It's been beaten into me.
Yeah. All right. Book or podcast? What are you reading or listening to right now?
So I go through a lot of books. I listen when I exercise. So my current book, and I'll just give you the one that's real time right now. It is my app will open. Scaling Up by Vern Harnish.
Scaling Up by Vern Harnish. I haven't heard that one yet.
Yes. Mastering the Rockefeller Habits 2.0. And so it's a good book. When I listen to a lot of these books, these are about really breaking through between a small company and a large company, how you have to hire different people and look for different skill sets and really go through that scaling activities.
Yeah.
It's a really good book on the reminders of best practices. You know,
Yeah.
you hear most of this stuff here and there, but it's always good to get a good reminder.
Yeah. I love that. All right. This is a fun question. If you had a little bit of magic dust and could sprinkle it anywhere on your company, where would you sprinkle it?
Well, I have right now, one of our AI developments is behind where it needs to be. And I would love if I had magic dust just to get that dev work done.
Mhm.
Boom.
I wish I could help you. I can't help you. Can't do it. Well, okay. Before we get to the last question of the day, let our audience know how they can get in touch with you, find you, all the things.
Yeah, so you can find all the information you need about AdviNow Medical at www.advinow.com. Happy if you want to reach out to me. My email is james.bates@advinow.com. And I may refer you to somebody else, but happy to take the emails and make sure that someone
Awesome.
reaches back out to you to contact you.
I love that.
I spend a lot of my time mentoring and helping smaller companies. So always happy to be of assistance where I can be.
That is a great shout out right there. And if no one emails you from this podcast, from listening, and after you saying you mentor, they better do it. I'm just saying right now, somebody better be emailing and writing that email address down. So that's amazing. All right, last question of the day. What is most inspiring you today?
So what's most inspiring me is really how doctors and hospital systems are looking towards technology to solve their problems.
Mm,
It has not been that way in healthcare. It really has not. And so this is really just the last couple of years type of phenomenon, and it's
yeah,
accelerating. And so it's a really exciting time for us because of that.
yeah. I love that. As two of my family members work in the hospitals, not as doctors and nurses. Actually, one's a nurse. I should take that back. But they're in more now the corporate setting of
Sure.
training and development and on the HR side, but lived through COVID in the hospitals. I can only imagine how much AdviNow has helped change their lives too. So thank you for what you've done. It's amazing.
Absolutely. Thank you. I appreciate you taking your time with me today.
Yeah, it was a great conversation. I just want to encourage everyone that's watching to save this show so that you can come back, email James, follow him, and really just get some wise business nuggets that he shared with us. It was a great show. So thanks for everyone who joined us today. Don't forget to like and subscribe so you don't miss when a new conversation drops just like this one. But a special thank you to you, James. This was a great conversation. I really appreciate you sharing your story.
I appreciate it, Heather. Thanks for having me on the podcast.
Thanks. Bye.
Bye-bye.